My name is Catherine Ebert, and I've been a palliative care volunteer for 16 years. I knew I would do this 20 years ago. I decided. A person very close to me passed away, and it was heartbreaking because their partner couldn't even go into the room. And I went in and I said, this is it. This is what I need to do. Very often it's the family who benefits the most. If the patient, for example, is no longer responding, the family is there. We're very fortunate to have such a wonderful bilingual hospital here that offers such a variety of services and more services. People ask me, like you have asked, how can you be a palliative care volunteer? Many people can't do it. And it's really not that difficult because you just have to be yourself, nobody else but yourself, and you attune with the person you're with. You know whether they want to hear something from you or they don't. And I also do bereavement follow-up, which after the patient passes away, I keep in touch with the families, and sometimes if there's no family, I'll keep in touch with a close friend. And they too will open up to me sometimes and tell me things that they weren't able to talk to other family members about. And they are very, very happy when I call them. So I keep in touch for about a year, sometimes longer, with family members of patients who've passed away. If someone chooses to volunteer at the hospital, the best thing they can do is to call the volunteer's office or speak to another volunteer and see how they feel. There are many different departments they can volunteer in: patient services, administration, they're in surgery, they're in reception, and palliative care is not for everyone, but it's very, very rewarding. And just being there for people who are lost, you know, there's always a way you can help people out. So we really appreciate you watching and listening to this radio telethon, and you can make a donation, which is very, very welcome, by calling the number 1-844-888-3444 between 11 a.m. and 8 p.m. Your donations are more than welcome, and thank you for donating.